Today we'll discuss the membrane biocompatibility of dialyzers. This topic is essential in understanding how dialyzer design affects both short-term safety and long-term patient outcomes. Biocompatibility refers to how well a dialyzer membrane interacts with blood without causing harmful immune or clotting responses. Poorly compatible membranes may cause acute complications like hypotension, chest or back pain, and transient leukopenia. Over time, they may also contribute to chronic inflammation, oxidative stress, and cardiovascular complications. Several factors affect biocompatibility. First, the material. Cellulose membranes are the least biocompatible. Modified cellulose has moderate compatibility, and synthetic polymers, such as polysulfone, are highly biocompatible. Second, sterilization. Ethylene oxide can cause reactions, while steam or gamma irradiation are better tolerated. Finally, surface modifications like heparin-coated membranes, vitamin E-coated membranes, or hydrophilic coatings further enhance hemocompatibility. When blood contacts the dialyzer membrane, several biological responses may occur. Complement activation can cause hypotension and symptoms such as chest or back pain. White blood cells may temporarily drop, especially with less compatible membranes. Cytokines like IL-1 and TNF-alpha are released, contributing to chronic inflammation. Platelets can also be activated, increasing the risk of clotting in the circuit and the need for anticoagulation. In clinical practice, unmodified cellulose membranes are less preferred due to higher risks of acute and chronic complications. Synthetic membranes provide better tolerance and lower inflammation. Heparin-coated membranes are particularly useful in patients at high bleeding risk, as they provide local anticoagulation and improved hemocompatibility. Let's look at the different types of dialyzer membranes. First, unmodified cellulose membranes. These are the least biocompatible. They strongly trigger the immune system, leading to problems like low blood pressure and temporary white cell drop. Because of this, they're rarely used today. Next, modified cellulose membranes. These are improved by changing some chemical groups, which reduces immune activation. They're moderately biocompatible and still used in some places since they're cost-effective. Then we have synthetic membranes, such as polysulfone or PMMA. These are highly biocompatible, cause very little immune reaction, and are now the standard in modern hemodialysis. Finally, coated membranes, like those treated with heparin or vitamin E. These offer extra protection by reducing clotting, oxidative stress, and inflammation. They're especially helpful for patients with bleeding risks or significant inflammation. As you can see, we've moved from cellulose to modified cellulose, then to synthetic, and now to coated membranes, all to improve safety, comfort, and long-term outcomes for dialysis patients. In summary, membrane biocompatibility is central to safe and effective dialysis. Advances in membrane design, from cellulose to synthetic polymers, have significantly improved patient outcomes. Surface modifications such as heparin or vitamin E coatings represent further improvements in hemocompatibility, reducing both acute and chronic complications. That wraps up today's video. Thank you so much for watching. I truly appreciate your time and support. If you found this helpful, don't forget to like, subscribe, and hit the notification bell so you won't miss future content. More videos are coming soon, so stay tuned.